Who is an EKG technician? Description. The electrocardiograph technician program provides an overview of basic cardiovascular terminology, anatomy, and physiology, focuses on the proper placement of electrocardiogram (EKG) leads and maintenance of equipment to obtain an accurate 12-lead EKG. Learn to recognize cardiac arrhythmias. The course teaches responsibilities of EKG technicians and provides clinical laboratory opportunity to develop entry-level skills. Course prerequisites. None. Nature of the EKG technician work. Cardiovascular technicians who obtain EKGs are known as electrocardiograph or EKG technicians. To take a basic EKG, which traces electrical impulses transmitted by the heart, technicians attach electrodes to the patient's chest, arms, and legs, and then manipulate switches on the EKG machine to obtain a reading. A printout is made for interpretation by the physician. This test is done before most kinds of surgery or as part of a routine physical examination, especially for persons who have reached middle age or have a history of cardiovascular problems. EKG technicians with advanced training perform Holter monitor and stress testing. For Holter monitoring, technicians place electrodes on the patient's chest and attach a portable EKG monitor to the patient's belt. Following 24 or more hours of normal activity by the patient, the technician removes a tape from the monitor and places it in a scanner. After checking the quality of the recorded impulses on an electronic screen, the technician usually prints the information from the tape so that a physician can interpret it later. Physicians use the output from the scanner to diagnose heart ailments, rhythm abnormalities, problems with pacemakers. For a treadmill stress test, EKG technicians document the patient's medical history, explain the procedure, connect the patient to an EKG monitor, and obtain a baseline reading and resting blood pressure. Next, they monitor the heart's performance while the patient is walking on a treadmill, gradually increasing the treadmill speed to observe the effect of increased exertion. Like vascular technologists and cardiac sonographers, cardiographic technicians who perform EKG, Holter monitor, and stress tests are known as non-invasive technicians. Some EKG technicians schedule appointments, type doctor's interpretations, maintain patient files, and care for equipment. Working conditions. EKG technicians generally work a 5-day, 40-hour week that may include weekends. Those in catheterization labs tend to work longer hours and may work evenings. They also may be on call during the night and on weekends. EKG technicians spend a lot of time walking and standing. Those work in the catheterization labs may face stressful working conditions because they are in close contact with patients with serious heart ailments. Some patients, for example, may encounter complications from time to time that have life or death implications. Employment. About 3 out of 4 jobs are in hospitals, primarily in cardiology departments. The remaining jobs are mostly in offices of physicians, including cardiologists, or in medical and diagnostic laboratories, including diagnostic imaging centers. Training, other qualifications, and advancement. For basic EKGs, Holter monitoring, and stress testing, few months certification programs exist, but most EKG technicians are still trained on the job by an EKG supervisor or cardiologist. On-the-job training usually lasts about 8 to 16 weeks. Most employers prefer to train people already in the healthcare field, nursing aides for example. EKG technicians usually undergo a minimum of 60 hours training. They may be working part-time to gain experience and make contact with employers. EKG technicians must be reliable, have mechanical aptitude, and be able to follow detailed instructions. A pleasant, relaxed manner for putting patients at ease is an asset.